Is the personal or clinical care that you are providing safe and right for the people you support? And is it provided with dignity? And is it meeting your clients' needs, goals and preferences in a way that optimises their health and well-being? Well, let's take a look. Hi, I'm Donna from Culturally Directed Care Solutions, where we give you the knowledge and tools to help you provide quality care with confidence. If you're new here, consider subscribing so you can keep up to date with the latest in aged care reforms and practices. Today, we are looking at Standard 3, Personal and Clinical Care. The consumer outcome for Standard 3 says, I get personal care, clinical care, or both personal care and clinical care that is safe and right for me. Now, I know that some of you are not providing clinical care, but you may provide personal care support. So either way, the requirements are still relevant. Both types of care, clinical and personal, are really important in helping maintain a person's sense of well-being, good health, and helps maximise their comfort and dignity. This is especially important if they are nearing their end of life. Standard 3 covers a wide range of activities too. It includes provision of showering, personal hygiene, help with dressing, nursing, as well as providing help for someone to access specialised therapy services. It includes helping people with cognitive impairment and dementia too. The key for those providing care under this standard is an understanding the responsibility and the scope, along with the role your service has in helping a client to receive timely and appropriate clinical support when needed. We also need to remember the importance of the person in personal and clinical care. We need to recognise that all standards are linked. Personal clinical care should be planned to meet the person's assessed needs, as we saw in Standard 2. It should be delivered in a way that upholds Standard 1, supporting the person's dignity and allowing them to exercise choice. If they don't want to shower that day and there is no valid reason to encourage them to take a shower, then we need to respect the client's choice. The consumer statement finishes with the words, safe and right for me. But what does that mean or look like? Well, let's think about a common example like showering. Showering can pose a challenge for some people and in some settings. You need to access bathrooms that are safe and support the person. This might mean having handrails installed, shower chairs, non-slip flooring, and enough space for someone to help if necessary. And not all bathrooms do this, so you may need to assist the person to access modifications to improve the safety of that room and help with the effectiveness of that process. Modifications can also help a client to shower more independently, so consider this as well when you're planning the supports. Some clients may have a preference of showering only 2 to 3 times a week rather than daily. And for a lot of elderly, this is fine. If there are health conditions though, such as incontinence, you may need to look at other ways to support and encourage safe hygiene and skin integrity. This brings us to the staff who provide support. It's important that they are appropriately trained. This means that they understand how to provide effective personal care that supports the client's dignity, as well as understanding when to step back and allow the person to do as much as they can themselves. An untrained staff member with limited practical experience can unintentionally contribute to someone's condition worsening or put them at risk from infection. Now, as a provider, you often need to balance safety with personal preferences and choice. So how do you do this? For example, you have a client who loves to take a bath, but you know that there's a high risk of falling or even worse, drowning. You may need to look at the bath facilities that they have, the equipment, and come up with something that works for them. It's important to focus on the desired outcome and work back from there. It's also important to involve the client in the process. That brings us to risks and expectation that services manage. High impact and high prevalence risks. I guess the first thing here is, well, what does that cover? Well, some of the more common risks that might need to be considered include having adequate hydration and nutrition, choking hazards, the delivery of medication, helping with pain management and pressure injuries and falls. Now, being alert to the changes in a person's health status is a critical part of supporting clients and managing risk. Make sure that your staff have had training in signs and symptoms and know how to escalate a concern. After all, it's the support workers who are the eyes and the ears on the ground. This standard also includes the need to work at minimising infection-related risks. In brief, this means that your service needs to have good hygiene and infection control practices in place, and make sure that your staff are trained in them. An example of this might be looking at how your services manages a client's personal care where they have a known infection which could adversely impact on your staff or other clients. It could relate to the laundry management practices. For example, do you have processes in place to prevent cross-contamination? And what about the term antimicrobial stewardship? What does that mean? Well, if you know that a client has been prescribed a course of antibiotics, it is really important that they are supported to finish the course. This might mean prompting the person to remember to take their tablets, taking them to the health clinic to complete a series of treatments, or even educating the person about the importance of completing the course of medication. The aim of this antimicrobial stewardship is to help reduce the risk of microbes becoming resistant to antibiotics in the general population. So how are you going to stand by your clients and support them to live life their way? If you want more information about this standard and other helpful resources, click on the link in the description box below, which will take you to the CDCS Community Resource Hub. Next time, we'll cover Standard 4, which is about providing services and supports for daily living that are safe and effective, that optimise independence, health, wellbeing, and support a good quality of life for your clients.